After bladder surgeries and cancers, patients often suffer from bleeding into their urine, which is known as hematuria. To treat this, they are put on a procedure called continuous bladder irrigation, or CBI. During this procedure, saline from a saline bag flows into a patient's bladder where it flushes out blood and urine, which all exits into a waste bag. Healthcare workers have to constantly monitor the supply and waste bags and change them whenever they get too full or empty.
This procedure is far from perfect.
One of our sponsors, Dr. Raymond Young, has stated how CBI can be a significant burden on healthcare workers and can cause serious morbidity if not managed properly.
CBI also lacks a standard and objective treatment protocol. Currently, healthcare workers visually assess the outflow fluid to estimate how much a patient is bleeding. They use ambiguous color terms such as rosé, cherry, or wine to then manually and subjectively adjust the saline flow.
Altogether, this increases patient safety risks. In fact, 40% of all patients on manual CBI still develop urinary tract infections due to the ineffectively managed procedure. What's worse, after surveying the landscape of existing CBI technology, we found that there is currently no clinically ready constant CBI monitoring system available on the market.
After 9 months of development, we have created Euroflow. Let's take a quick look at a demonstration to see Euroflow in action. First, Euroflow's hematuria color sensor quantitatively measures the blood concentration in the patient's output urine with over 95% accuracy. This graph shows Euroflow's feedback control system. Upon detecting excessive bleeding, the device increases the saline flow rate into the bladder to wash away the blood. As the bladder is irrigated, the blood concentration tapers off over time, and our device responds by slowing down the flow rate. In effect, Euroflow autonomously optimizes continuous bladder irrigation flow. In practice, our device modulates the saline flow by means of a tube compression apparatus. This component externally squeezes CBI tubing to increase or decrease saline flow. Also, heavy-duty weight sensors actively record saline and waste bag volumes and fluid flow rates into and out of a patient with over 95% accuracy. All of this measured data is saved and organized on Euroflow's responsive touchscreen user interface and secure mobile website at www.euroflow.io. Our device actively checks for critical patient issues with a robust notification system featuring lights, audible alerts, and text message notifications to healthcare professionals. By providing all of this remotely accessible live data, clinicians and nurses are able to easily monitor patient status from anywhere in the world.
Euroflow has the potential to transform urological care by saving almost 5 million hours for healthcare workers and, more importantly, improving and enhancing patient safety and outcomes after surgery. Thanks for watching. We're Team Euroflow, and with us, you're in good hands.